Inflammation is the most important defense mechanism of the human body, which through a response activation of the immune system protects itself from external pathogens, infections, and injuries. Its purpose is to locate and eliminate damaged tissues so that the body can initiate the healing process. By its importance, we distinguish different types of inflammation. Acute inflammation. It is a response to a sudden body damage of short duration. It disappears in a matter of hours or days. It plays an essential role in the process of repair and regeneration of organs and tissues. Acute inflammation causes reddened skin, pain or tenderness, swelling, and heat in the affected area. Chronic inflammation. Chronic inflammation can last for months or years even after the trigger disappears. It causes abdominal pain, chest pain, fatigue, fever, joint pain, or stiffness, ulcers, and skin rashes, among other symptoms. Systemic inflammation. Unlike acute and chronic inflammation, systemic inflammation means that it affects the whole organism rather than a single area, organ, or tissue. This kind of inflammation is detected at the molecular level in the bloodstream. This type of inflammation happens when the immune system is constantly activated, defending the body. Unresolved inflammation, persistent stress, infections, or chronic systemic disease can put the body in a constant pro-inflammatory state and trigger a permanent inflammatory response. Chronic systemic inflammation increases with age, also known as inflammaging, is due to unresolved acute inflammation becoming chronic systemic. It correlates with immunosenescence, aging of immunity, and predicts the risk of cardiovascular disease, frailty syndrome, and multimorbidity. Sterile inflammation occurs in the absence of microorganisms and is generally associated with the recognition of intracellular contents released by damaged and necrotic cells, also known as damage-associated molecular patterns, by inflammatory signaling receptors. The body continues to send inflammatory cells even when there is no external danger. For example, in rheumatoid arthritis, inflammatory cells and substances attack joint tissues, resulting in inflammation that comes and goes and can cause severe joint damage with pain and deformities. In short, unresolved inflammation drives the development of clinically severe and compromised autoimmune injury and pathology by promoting sustained inflammation and immune system hyperactivity. We know that resolution of inflammation is not simply a passive return to homeostasis, but rather an active process mediated by specific molecular and cells, such as specialized anti-inflammatory mediators.